So, AI in breast imaging. When we think about breast imaging, you used to be like we're now entering the era of precision medicine. It used to be a one-size-fits-all approach. However, the outcomes were often disappointing because there is no average patient. So precision medicine is an emerging approach that for disease treatment and prevention that takes into account individual variability, genes, environment, and also the lifestyle of each person. It has been labeled a bold concept or audacious aspiration, but I think we're actually getting pretty close there. Integral to precision medicine is a systems biology approach, which basically is the study of complex biological systems, their interactions, and temporal environmental changes. To facilitate a precision medicine systems biology approach, we have to integrate computational and mathematical modeling to integrate all the omics data. So you remember, like we started out with genomics, then came proteomics, metabolomics, and obviously now we have also radiomics, so that is bringing the imaging on board. This precision medicine approach crosses over across disciplines, biology and obviously imaging, but we also need computer science, engineering, bioinformatics. So this is a very multidisciplinary task we have to achieve. And when we think about where we started out, this is sort of the advent of AI-enhanced medicine. We started out with our X-rays being solely morphologic imaging, and we have now advanced. If you ask me where we are at the moment, I think we are not fully bionic yet, but we have had significant advances that in particular in medical imaging techniques and also what we can do for image analysis. And in particular, I think that sort of boosted this era of AI-enhanced medicine. We developed high-throughput methods to actually extract and correlate imaging parameters with molecular and other outcomes data in a reasonable time frame and amount. So it was like it used to be one computer would calculate all those features. We could do that before, but it took so long, and the computing power, we didn't have that to actually get results that we can in a reasonable time frame. And these models, we can now develop models that can run fast and give us results in a reasonable time frame. So this has basically heralded a completely new direction in medical research. This is radiomics, the AI-enhanced medicine. And when we think about what is AI, AI basically is just a term, umbrella term, that describes that computers can mimic human intelligence. Then we have machine learning, that basically is techniques where the machine improves a task with experience. So they have to be, this can be performed on also a smaller data set, and within that term is then also deep learning, but machine learning is what the majority of current studies we have out there has been using. So basically it enables computers to learn from pre-existing data without explicit programming. There's unsupervised learning where the computers detect within the training set patterns. This is often used as clustering. Supervised learning, they are trained on ground truth data. So the computer knows this is, for instance, tumor, no tumor. The computer knows it, and it has been labeled by an expert. And so the algorithms can learn how to classify medical images given sufficient data. And I think that has also been usually a breaking point, sufficient data. In breast imaging, the most common problems have actually been classification, that is either tumor, no tumor, benign, malignant, and then also there's different aspects of cancers, as well